And welcome again to Speak Your Mind. I'm your host, Gwen Magoon. And of course, this morning, the discussion will focus on rheumatic heart disease. We'll look at the cause, we'll look at the symptom and also the treatment. And to help us understand rheumatic heart disease better, we have as our in-studio guest, Dr. Marian Korai, who is the senior pediatrician at CWM. Dr. Korai, thank you so much for your time and welcome to the show.
Thank you.
Okay, to begin, tell us, what is rheumatic heart disease?
Okay, so rheumatic heart disease is an acquired heart disease, meaning people are not born with rheumatic heart disease. So it occurs after a child or an adult has acute rheumatic fever due to what we call group A streptococcus infection or strep germ, as you can call it. So strep germ can affect or can cause sore throat, and let's say about 100 children have a throat infection by the strep germ. So throat infection can be caused by plenty other germs, but in particular the strep germ can cause acute rheumatic fever. So say in 100 children who have strep infection causing throat infection, not all of them will develop acute rheumatic fever. So in 100 children, about 3 out of the 100, 0.3 to 3% out of the 100 can have acute rheumatic fever. And there are symptoms, which I believe we will talk about later. So once these 3 out of the 100 have acute rheumatic fever, 40% of these children will, 40% of these children will have a normal response and do not have acute rheumatic heart disease. But some of them will have an abnormal immune response and develop rheumatic heart disease, which is inflammation to the valves of the heart.
Now, according to the National Register of Rheumatic Heart Disease, Dr. Korai, how many people have been diagnosed with RHD in Fiji in the last year?
So currently the system is once they are diagnosed in the hospital or diagnosed from the screening that the school team are doing, they come to the hospital for confirmation with echo by us, and we register. So there's a form that we fill and it goes feedback to the registrar with the ministry. And so far, they've got about 4,000 cases registered, which I believe is still under diagnosed or we are under reporting.
Dr. Korai, acute rheumatic fever, can have severe complications. Talk to us about deaths. How many deaths and how many premature deaths? Are Fijian children and young adults still dying from rheumatic heart disease?
So acute rheumatic fever and can cause rheumatic heart disease, as we know. So rheumatic heart disease can come in mild, moderate, and severe. And it's the children or young adults with severe who can have deaths. And so far, out of a study that was done in 2000 and was done looking at data from 2008 to 2012, 378 deaths from rheumatic heart disease. And they die in the severe form when the heart fails. So it's important that we know somebody has rheumatic heart disease or at risk of having rheumatic heart disease at the earlier stages, so they don't go into severe and they have death. And in the 5 years to 29 years age group, it is the second most common cause of death, secondary to drowning. So this is the productive years and our young people premature deaths.
That's very true. You did answer the question. I was just going to ask, the groups that are at the highest risk. Eh? So that's from 5 to 19, did you say, Dr.?
5 to 29 years of age.
5 to 29 years. Oh, okay. Now, is the most common cardiovascular heart disease in young people in Fiji, is it RHD?
Yes, it is. Rheumatic heart disease is the most common acquired heart disease, and the statistic is about 8.5 per 1,000 in Fiji, and about one child in every classroom. So that's very high.
Now, what is the main cause of rheumatic heart disease?
So like I've said earlier, the strep germ causes throat infection. The body, with any infection, the body will have a immune response or defense mechanism to produce antibodies or soldiers to fight against this infection. So let's say 100 children have this strep infection, 97 of them will have a normal immune response. The body will produce the soldiers or antibodies in the body, kill the germ, end of story. However, 3 of them, which at the moment we can't predict which 3 or which children they would respond inappropriately. So their body will produce antibodies, which again reacts with different parts of the body. So they can come with joint pain or they can't walk because of the joint pain, or they can come with some skin rash and the heart inflammation or scarring of the heart valves. So the joint pain and the skin signs can disappear, but it's the damage or scarring to the valves of the heart that stays and can progress and get worse if the child or young adult has recurrent sore throat by this strep germ.
You know, when you're looking at the high-risk group, when you're looking at children and young adults, are the symptoms the same or are they different?
Yes, the symptoms are same in the when somebody has acute rheumatic fever. However, the peak age group is 5 to 15 years of age. Majority of children present with the symptoms then. And some do come to the hospital or seek medical advice and we identify. Some do not. And we diagnose them when they have severe rheumatic heart disease.
Well, after the break, Dr. Korai will help us understand strep throat a little better, and we'll go into detail more about the symptoms of rheumatic heart disease. This is Speak Your Mind on Gold FM and also FBC TV. Our in-studio guest is Dr. Marian Korai, Senior Pediatrician, CWM, and our conversation this morning is on rheumatic heart disease. And also, if you have a question on rheumatic fever or rheumatic heart disease, you can give us a call, 3220906, and of course, Dr. Marian will answer your questions directly. Dr. Marian, as you explained a little earlier, rheumatic heart disease begins with a strep throat caused by a bacteria. How is this diagnosed?
Okay, excuse me. So, like I've said earlier, when somebody has a throat infection by strep germ, it doesn't mean 100% they will have acute rheumatic fever or rheumatic heart disease. So when somebody comes in with streptococcus infection, so how do we tell? We look at the throat, and if we see small pustules in the tonsils behind the throat, then it's highly suggestive that this sore throat is by the strep germ. So for us, doctors or medical people, we will give the injection as this is most probably streptococcal infection. So to confirm that, we can do a throat swab, okay? But otherwise, the practice is once we suspect, we will give the injection. Now, if somebody had never came to us with a sore throat, but later has developed signs for acute rheumatic fever, so they might come in with a painful joint, or what we call migratory polyarthritis. That means they have shoulder pain. In 2-3 days, it goes away, and the joint pain has moved to the elbow or the ankle. Then we will suspect acute rheumatic fever. And then there's a criteria called Jones criteria. So as clinician, we have to do the investigation to to confirm whether this is acute rheumatic fever, because sometimes the only presentation complaint they come into us for is the joint pain, which is one of the most common signs for acute rheumatic fever. So we have to do the blood tests. One is including a throat swab to confirm that yes, this person have had strep infection, and there are other parameters that we look at, and then we confirm that yes, this person has had a sore throat caused by strep germ and now has acute rheumatic fever. Then we label this person, and they might not have signs that the heart is involved. If they have a murmur or an abnormal sound of the heart, then we know that the heart is involved. If not, we do an echocardiogram or scanning of the heart, looking at the valves. Then we can confirm.
Dr. Marian, another symptom too is a skin infection. Could you just give us some clarity on this, what this strep skin infection is?
Okay. So yes, strep germ can also cause skin infection. There is little evidence not convincing evidence that skin infection can cause acute rheumatic heart disease as well. But it is enough for us to advise people, if you have skin infections, don't take it lightly, get medical attention and treatment. Because yes, there is enough evidence to suggest that it can cause acute rheumatic fever and rheumatic heart disease.
You know, after a person has been infected, how long does it take for the symptoms to appear?
So if they've infected with a strep germ, then the symptoms can come 2 to 7 days later. Yeah.
You know, sometimes, especially with young children, they find it hard to explain, what they're feeling. So, what can a parent do in this instance?
Like we would say for anything, if a child is unwell, seek medical attention.
Could they also check for redness in the throat?
Redness, parents can look in the throat themselves, but even as we should not be treating our own family. It would be best if they can to somebody.
Yeah, see a doctor immediately.
Yes.
Yeah, that's right. And the swab test, how long is it before results are confirmed?
So the throat swab that can be done here in Fiji, it yields only 10%. You can still have a strep infection. Doing a throat swab might only give us 10% of positive. So even a throat swab is negative, that doesn't mean the child or the person doesn't have strep infection. There's also another blood test that we do, that it looks for the antibodies that are circulating in the body. These are antibodies against the streptococcus infection.
You know, what should parents be aware of when their child has strep throat? Can they give them aspirin to sort of ease symptoms?
So if someone has a sore throat, get medical attention, and if we suspect by looking through the throat and seeing pus or exudates, what we call, then we will give the injection. It's a penicillin injection. Aspirin is not used in this scenario. Aspirin is usually used for if they develop acute rheumatic fever and they have what we call arthritis or painful joint, and then we will prescribe the aspirin. And the aspirin is a very, very high dose for acute rheumatic fever. So like I've mentioned before, we as clinicians, we have to do all the investigation. If it fulfills what the criteria for us to label this person as having acute rheumatic fever, then we will prescribe the aspirin, which is a very high dose, and it has its own side effects. So we need to be sure, and then we start the aspirin. Otherwise, we would give Panadol for pain until all the confirmatory results are in.
Speaking to us then is Dr. Marian Korai, the senior pediatrician at CWM. Well, coming up, we're going to talk about strep throat. Is it infectious and how it is spread? This is Speak Your Mind on Gold FM and FBC TV. Welcome back. And of course, we are having a conversation this morning with Dr. Marian Korai. Just where we left off, Dr. Korai, is strep throat infectious and how is it spread?
Excuse me. Yes, it is infectious and it is spread by airborne. So sneezing, that's one of the reasons too. It's common in the 5 to 15 years of age group. So simple things like hand washing, covering the mouth when sneezing, because it is airborne, just like other germs that are out there in the environment.
So does everyone in the house need to be checked if one person has a positive strep throat swab?
There's a yes. So everybody in the house with having a sore throat should be checked, yes. And it is mainly associated too with the personal hygiene. It's high risk in poor sanitation environment, overcrowding. It can spread easily compared to good ventilation homes or less crowded homes.
Well, before we touch on acute rheumatic fever, there's just a question I needed to ask about rheumatic heart disease. Which heart valve is commonly affected, and what's the function of that valve?
Okay, so in the heart, there are 4 types of valves, and these valves between the chambers of the heart, okay, and they are like doors. So what happens is when this part of the heart pumps blood out to the rest of the body, and when it relaxes, this valve should close, and there shouldn't be any leakage back into the other chamber or to the other pipe. So in rheumatic heart disease, there's what we call mitral valve is 80% of the time affected, and second is aortic valve, 20% of the time affected. So this valve's job is, they're like doors. They open when the blood should be flowing into that chamber, and they close. They should close completely when the blood is not flowing in. So when these valves are affected, just like when you have a cut on your skin, there's inflammation. When the antibody goes and cause inflammation or attach to the valves and cause irritation and inflammation, the valves are scarred. So they're scarring. And so they don't do their job properly. They don't close properly. Okay, so they can be stiff and don't close properly, or they can be in a shape that they are not closing properly. So there is what we call regurgitation of blood or leakage of blood back into the previous chamber where they shouldn't be, So when they open nicely, blood will go, but when it's time for it to be closed, it's not closing properly, and there's leakage back. So the next pump this part of the heart has to do, it has to work harder, not only to pump the blood that has just come into it from the lungs, let's say the lungs, but it also has to cater for the extra blood that's coming back, leaking back into this chamber. So it makes the heart work harder.
So that's when surgery occurs too sometimes, but we'll touch on that a little later. Right now, if we could just focus on acute rheumatic fever. What is acute rheumatic fever and how serious is it?
Okay, so acute rheumatic fever, like I've mentioned earlier, can occur in some people after a strep germ infection. So acute rheumatic fever can affect different parts of the body. So the body produces antibodies to kill this germ, but some parts of the body has a protein that looks like this germ. So the antibodies or these soldiers go and react with these parts of the body. So it can be in the brain, an area we call basal ganglion. So sometimes children can have abnormal movement. It can be in the joint, and that's why they come with joint pain, or it can be the valves of the heart, the skin, or sometimes they can have lumps on the body. Between those symptoms, the most common is the joint pain okay, the joint swelling or pain, or the valves. The others are very uncommon, like 2% of the people can have. Even me being working for 10 years now, I've seen only the skin rash once. So those of us in the medical profession to say that that's very rare. So most common is, like I've mentioned, is the joint pain in the heart. And the other symptoms do disappear, but the scarring of the heart stays and it can get worse, and that's the one that can kill.
Is this rare amongst adults?
The peak age group is, like I've said, is 5 to 15 years of age. But even adults can have, they can be recurrent episodes in adulthood. So sometimes when it affects the heart, we don't see like a joint pain, so we don't know. So silently, this person can have recurrent strep infections and worsening damage to the valves. And until it's severe, they have symptoms like they can't breathe easily, or they can't climb up steps because the heart is failing. That's when they present, and it's a severe stage. So it's better for us to know if somebody has rheumatic heart disease in the mild or moderate, or even before they have mild, where they come with a sore throat and we give an injection.
Remember as well, if you have any questions on rheumatic heart fever or disease, you can speak to Dr. Marian. She'll answer your questions directly. You can call 3220906. Dr. Marian, just continuing with our discussion, the primary prevention of rheumatic heart disease is the administration of antibiotics. Why is it important for a child to finish the full course of antibiotics?
Okay. So, number one is, whatever the reason we are giving the medication for, the medication work, they have half-line, we call. So within this period, they are no more in the blood. So that's why we need the next dose. And not all germs need only one dose of medication, and that kills all of them. So that's why we give it for certain period, and people need to continue until the course is finished. Number two, if we stop the medications in between, without finishing the course, the body can develop resistance to these medications. And penicillin is one of the most cheap and reliable medication that we have available in Fiji, and we wouldn't want resistant to this drug.
Well, coming up, we'll discuss with Dr. Marian how long a child with rheumatic fever, how long they need to have penicillin injections for. Stay with us. Welcome back to Speak Your Mind. And of course, Dr. Marian, just continuing from where we left off, how long will a child with rheumatic heart disease, how long do they need to have penicillin injections for?
Okay, so that also depends if they're mild, moderate, and severe. So for our child with mild rheumatic heart disease, which we classify after we do a scan of the heart or look at the heart, they will need to continue the injection once every month until they are 21 years of age, or 10 years after they've been diagnosed, whichever that's longer. So that means if a child is diagnosed at 9 years of age, 10 years time would be 19. That doesn't mean the child stops at 19. They will have to stop after 21 years of age, provided the mild rheumatic heart disease haven't progressed to moderate or severe. In severe rheumatic heart disease, in our setting, we sometimes even have to advise them for lifelong injections, Benza injections.
If you could just touch on tertiary prevention when you look at heart valve surgery. I mean, any form of heart surgery is expensive. So we're kind of fortunate that heart surgeons have come to Fiji to actually, do these free of cost, especially for those who can't afford it. But how much normally would surgery like this cost?
These surgeries are quite very, very expensive. The valve itself, I don't know exact the amount, but they cost thousands of dollars just to put the valve in there. And then you add costs like bringing a team in, cost for the hospital. They are admitted into the ICUs, put on ventilators, the cost of the bypass machine. So when this kind of surgeries are done, they call open heart surgery, where the heart is stopped and a machine is working as doing the job of the heart and the lungs while the doctors work with the heart. So these are very expensive equipments and surgeries. Okay, so yes, we are very fortunate that the team is coming and doing these valve surgeries for us. But it would be more effective if we ensure people don't progress to severe rheumatic heart disease and having to have valve surgery. So that's why it is important if we work on the preventive measures way before a person goes into severe rheumatic heart disease. So like I've said, when somebody has a sore throat, get medical attention. And if they diagnosed with mild rheumatic heart disease, be faithful to the injections, the penicillin injections, so that the disease doesn't progress to severe. And unfortunately, some of them, we're catching them when they're in severe stage. So that's the treatment, or that's what we can offer in the severe stages. But we'll rather not go there because it's expensive and it has its own complications. They will be on medications like warfarin, we called, which is a blood thinning medication. So overall, let's try to, catch or seek medical attention before anybody gets to severe rheumatic heart disease.
It's quite a large operation as well, considering
Yes.
the group that is vulnerable. There you're looking at children and young adults. But how many children have had a heart valve replacement in Fiji?
Okay. So I've worked for about 10 years now, and the teams that have come, I think, have done about 5 cases. When I say children, I'm talking about 14 years, 15 years below, valve replacement. Usually the decision to make, to do or put in a valve replacement is, kept until it's needed to. So mainly they are done in the adult age group, because sometimes when they put it in a younger child and the child grows, the valve doesn't grow with the child. So they might need to replace that again, meaning another second surgery. So there are other things that they can do, like valve repair, but the surgeons will only do the valve replacement if it's really indicated in a child.
Dr. Marian, as part of you trying to detect rheumatic heart disease, early and trying to bring it under control, talk to us about the rheumatic heart disease screening program. Is that still continuing? Give us an update.
Okay. So at the moment, we have the Ministry of Health school team that goes out to the schools and do screening, handheld echo machines. So at the moment, because of the manpower and the costs, I think they're only looking at the classic students, and they screen with the handheld. And if they suspect, then another person does look at the valves and record images, brings it to us in the hospital, and we look at the images. And if we think, yes, this person has rheumatic heart disease, we bring them into the hospital system. So they come and be seen in the consultant clinic, and they go for their injections to the nearest health centers, but we accommodate them into the normal system.
How many school children have been screened for RHDC in the past year?
Those figures I'm not too familiar with. The school team would be more familiar with that. But we don't have the manpower to screen everybody at the moment, and we don't have a place where if a parent is worried about rheumatic heart disease, they can just walk in and get a screening like that. At the hospital, mainly if they are suspected with acute rheumatic fever or rheumatic heart disease, then we book them for the echo clinic.
Dr. Marian, work on the Fiji Rheumatic Heart Disease Prevention and Control Program, that has been ongoing since 2005, 13 years on. How's the prevention and treatment, has it sort of changed?
I think more and more parents are aware of acute rheumatic fever and rheumatic heart disease. This month is the awareness month, and I think people are also more aware compared to 9 or 8 years when I started working. We would have, a good number of children admitted in the wards with severe rheumatic heart disease. However, it is still around, and children are still coming in with rheumatic heart disease.
Just something else I wanted to ask you about the Rheumatic Fever Information System, which allows medical staff to record the injections received by patients and also monitor adherence to penicillin ongoing treatment. It was launched in 2016. What are some of the barriers?
So a child or even adults, everybody are scared of needles. So some children initially, they will not want to come for the injection. We also give a little bit of medication so they don't feel that pain that much. But I think our counseling is what's important. It's better to have injection once a month than having to have valve replacement few years down the line. When the children admitted to the hospital, it means parents don't go to work. It means, it causes economic burden as well. So, yes, nobody wants injection. Some people are allergic to penicillin, then we give them alternative of oral medication, which they have to drink every day. So remembering to do that is another story. So whatever the barrier is, I think for us medical professionals, the main thing is to get good counseling. So the child, most of them are old enough to understand as well, and the parents, even the public as a whole, should all understand the benefits of having the secondary prevention of having penicillin injections once a month.
On Speak Your Mind, Dr. Marianne Correa, the Senior Pediatrician CWM, and I thank you so much for your time, Dr. Marianne. Stay with us, because coming up next, Lavinia Rambuatoka will also share with us her personal story as a person living with rheumatic heart disease. This is Speak Your Mind, and on the show, we are focused on rheumatic heart disease, and we've got in studio a person living with rheumatic heart disease, Lavinia Rambuatoka. Welcome to the show. Thank you so much for coming to share your personal story. I mean, you were telling me earlier, you were only 18 when you was diagnosed. As a young adult, no one wants to hear that they're sick. It's a lot to take in for you, for your parents, What was it like coming to terms with your diagnosis?
I remember I was back in grammar, year 13, and being told, this was weeks before I sat for my external examination, and being told that I was diagnosed with RHD. I lost all hope at first as a teenager. My dreams just fell apart. I couldn't take it all in. But at first I was confused because I had no idea what RHD was back then. Yeah.
What were you doing? At that, you were at school, were you playing sports,
Yeah.
Taking selfies?
I was playing sports, yes. It was late afternoon, 3, when my grand aunt from New Zealand came over and told me to get in the car on her way to a private doctor because she heard about the symptoms and she said it sounds familiar. It was a common disease back in New Zealand, and she was trying to figure out the disease. It was when she came over and took me to a private doctor, Dr. Paula Sili, there at Namboa. It was there when I was diagnosed with RHD. Yeah.
You say that, you had symptoms,
Yeah.
What symptoms were you experiencing?
I was having these painful in painful reactions in my joints. I was bedridden for about 3 weeks. I could remember my dad carrying me to the bathroom and to places where I want to go around the house to chill or enjoy with the family. Yeah, so those painful joints I could never describe. I couldn't able to fold my arms, my legs. I was actually stuck to a position, and yeah, stuck to the position, and they had to adjust the way I had to sit or sleep to the position I am stuck with. Yeah.
That was pretty hard. I mean, that's just very, very difficult. And I wouldn't understand because I don't have rheumatic heart disease. But I'm thanking you for giving rheumatic heart disease a voice and a face this morning. Could you tell us about the treatment that the doctor started you on?
As I was diagnosed I could remember it was back at November. The first treatment I got was Benza. And that was when Dr. Paula explained what the Benza is for. It's a treatment that stops all these traps, the germs that causes the disease from causing more damages on my heart valves. So, and he was telling me how I could be on Benza for about 9 to 10 years before I could live normally. So, yeah, that's the cause of RH.
Lavinia, when you're talking about Benza, you're talking about an injection here? Is this an injection?
Yes, it is an injection. It varies. For me, I take 1.2 milliliters of Benza every 3 weekly. So after 3 weeks, I have to go get my Benza because it's when the strength of the Benza runs out. So I have to go and get my top-ups every 3 weeks.
So you've probably had hundreds of those injections. I mean, not that anyone's counting, yeah. But
Yeah.
what are you doing right now, Lavinia? I mean, since your diagnosis.
I was in Form 7 back then. I was informed by my teacher to take politics and law, and I'm doing that right now.
Wow, RHD has not stopped you.
Yes, not stop me.
Yeah. So how old are you now, Lavinia?
I'm 20, and I'm going on a 3 years journey as a Benza patient. I'm sorry, RHD patient.
Mhm. How have you managed so well? You know, the commitment to injections, that's very important.
Yeah.
Like if somebody's, newly diagnosed.
Yeah, for me, it was pretty hard, right? Try and merge all those school stuff and family stuff and as a patient, as an RHD patient. But then from the support from home, right? To get reminded daily to get my injections, right? Just like this morning as I walked out the house, they're like, remember your Benza is on as the end of the week. So with that kind of support, it carries me through as a Benza patient. I'm sorry, RHD patient. Yes.
And how are you in control of your health? Do you also have to watch your diet? Are you on a special diet?
Not really, because I'm on my status as a rheumatic heart disease patient. There's actually 3 stages to it. There's mild, moderate, and severe. I'm on the moderate status. So I'm not on the stage where you need surgery. So I don't really have to go on a diet, but I'm informed by my doctors to get Benza, even though if I feel well, because sometimes, because it doesn't show, right? It's something to do with the heart inside. So I always make sure to take my Benza every 3 weekly.
You also mentioned earlier, the importance of family support. How can family, support someone living with rheumatic heart disease, and how important is that?
To get reminded daily, and also to be treated as normal as we could be, because sometimes it's very insulting to. Sometimes they try to be nice, right, and giving us little work and stuff, but in some other ways we find it insulting because every day we try to be as normal as we can be, but then, but we do appreciate the support. But sometimes that restricts us from feeling normal. Yeah.
And I hear you're also very heavily involved in raising awareness on, rheumatic heart disease. Share with us, the work that you've done.
Mostly on social media, because this disease is common in young youths, right? So in social media, get updates on we how we get rheumatic heart disease, and some of you may not know that you have the disease, but it's there, and it's where, and social media is a platform where all young youths are found. So yeah, every time I get in social media, I either put up a story of how I'm getting my benza, why I'm getting my benza, and how to stay well and how to inform other youths too.
Is there a support group? I see a lot of young faces, people coming forward and sort of, being very actively involved.
Yeah, they're called Cure Kids. This is where we all meet up. I first joined Cure Kids this year, and it was I enjoyed joining this group, because as I've lost all hope, this is the group that inspired me and motivated along the way, reminding me that I'm not the only one going through this stuff. Like, there are some who've gone through this, and empowering each other along the way. Yeah, Cure Kids.
For someone who's recently diagnosed, how can they sort of get in touch, or is there any contact for Cure Kids?
Yes, actually, there's a doctor called Dr. Sai. I'm not sure of her contact, but I'm sure you can find her on Facebook. She's Dr. Sainyana, and yeah, you can refer to her for the Cure Kids program.
Any other last words? Anything else you'd like to add?
Yes, to young youths out there. For my case, I was not aware of what rheumatic heart disease is. But for today, I would like to remind all young youths out there, if maybe in the near future, if you get to have pain joints and sore throats, please think rheumatic and get treated as fast as you can before it causes further damages.
Naka, Lavinia Rambuotoka, thank you so much for coming in to share your personal story. And that's Speak Your Mind for another Tuesday. Until next Tuesday, you have a great week ahead.